But meantime, state leaders are reviewing school mental health services available at South Carolina Public Schools.
The governor requested this review just a couple of weeks ago, and state lawmakers got an update on where things stand. Our Jason Raven tells us more.
According to officials, there are 360 master's level mental health counselors working at South Carolina Public Schools, and more than 80% of students using these services qualify for Medicaid. Back in January, Governor Henry McMaster tasked the State Department of Health and Human Services to review the state's school mental health services program. The executive order directs the agency to assess the availability of these services to children in the state's public schools, identify any barriers to access, and determine the most effective way to use existing funds and if more money is needed.
I think our goal is to try to create an opportunity for school districts to have a slate of providers they can choose from, open the provider capacity up, and then provide the funding for the schools to be able to say, I want this provider, or I'll choose this one, whatever's working in my school.
The demand for these services has never been higher. Data shows since the pandemic began, suicide rates have increased in children and teens across the country, and the American Academy of Pediatrics and other groups declared a national state of emergency in children's mental health. The state leaders say all options are on the table to get more therapists in schools.
We think there's an opportunity to leverage and bring to bear telehealth, telemedicine in this area. We don't think that solves all of our problems, but it certainly helps alleviate a significant burden at this moment.
The Department of Health and Human Services also says they're looking at the charging practices. Now, some families in South Carolina have to pay for their children to see a therapist at school.
The balanced billing obviously is deterrent. I think that's the matter at hand is, do you want, and it's the will of the General Assembly and the governor, is this something we're going to fund for the state, or is this something we're going to bring to bear on private insurance and individuals to pay?
Director Robert Kerr says the review into the program continues, and he'll be speaking to lawmakers again at the end of the month. In Columbia, Jason Raven, 7 News.